Welcome to the What Women Want dashboard demo presentation on the Family Planning Reproductive Health track here at the GHTECHX 2021. We're so excited for you to join us today and to share this dashboard with you. My name is Nisha Singh, and I am an advocacy officer with the White Ribbon Alliance.
Hi, everyone. We're so thrilled to be here with you today. My name is Amanda Livingstone, and I am a Senior Advocacy Officer with White Ribbon Alliance. And to share a bit more about WRA, we are a global advocacy movement for reproductive, maternal, and newborn health and rights. Our movement is comprised of a vast network of affiliated alliances, networks, coalitions, and individuals. White Ribbon Alliance has always worked to increase collaboration between communities and governments to identify the challenges and co-create solutions to improve reproductive and maternal health outcomes. The What Women Want campaign embodies this principle. What Women Want demands for quality healthcare from women and girls is a global advocacy campaign to improve quality reproductive and maternal health care for women and girls and strengthen health systems. Because when healthcare is informed by women and girls who use it, it is better healthcare.
Absolutely. So Amanda, how would you describe what differentiates What Women Want from other conventional health surveys?
Well, in the most basic way, this campaign was different in that it posed an open-ended question for women and girls to respond to. And that question was, what is your one request for quality reproductive and maternal health care services? And then allowed for any response. The campaign is also different in that it collected women's aspirations, really what women want, rather than their complaints. The focus was to flip the traditional top-down approach that tends to shape health and development by having women's own demands for quality care lead the way. We wanted to place women's self-articulated needs at the center of health policies, programs, and accountability, and the responses will allow us to do that, and especially for family planning and reproductive health. What Women Want also stood out in its global reach of nearly 1.2 million women and girls, the largest ever canvas of women and girls about their wants for reproductive and maternal health care. And today we are sharing the recently launched dashboard, which brings you full access to their demands. So Nisha, what is the dashboard exactly?
Well, as you alluded to, the dashboard is an interactive visualization tool that puts the over 1 million demands from the What Women Want campaign directly at your fingertips. And if you're attending this session, we truly mean at your fingertips. This dashboard is for you. And one of the objectives for this campaign was to get to this point where different groups such as advocates, community members, duty bearers, donors, and media outlets, really anyone engaging in health and development will be able to center women's voices at various stages of their work to inform their strategies, the policies they're advocating for, and the partnerships they seek, just as a couple of examples.
Right. So the dashboard is not only intended to ensure that women and girls' voices are heard, but that demands and experiences are shared in an open, user-friendly way that actually results in meaningful change that impacts them directly.
Yes, we thought a lot about how to share this information. And while a Dropbox folder containing the hundreds of Excel spreadsheets would have been one option to tick that box, as you've said, it wouldn't be useful or usable, and ultimately it wouldn't enable the change that women and girls envisioned for themselves. But Amanda, you and I do actually remember when these responses lived in those hundreds of spreadsheets. So how did we get from there to here with this dashboard? How did we create it?
Yes, well, I already mentioned a bit about the methodology of What Women Want and the immense in-person, people-powered mobilization needed for the campaign and to actually reach and collect responses from 1.2 million women and girls. So in terms of the technical side of the dashboard and how we categorized over 1 million answers to an open-ended question about reproductive health, believe me, it was far from simple. At the start of the campaign, we were initially prepared with about 50 categories related to key areas identified for improved outcomes in reproductive and maternal health. But women's and girls' answers took us well beyond that. Mobilizers sent suggestions for new categories as they heard from women, and other categories were created or consolidated based on volume and recommendations from technical and country experts. A core group of reproductive and maternal health and rights experts from White Ribbon Alliance refined the codes and hand-coded approximately 800,000 responses, or 70% of the surveys received. This often involved sitting together in a conference room and discussing women and girls' answers to ensure that everyone was categorizing in the exact same way. The remaining 30% or so of the 1.2 million responses were coded with the help of a data engineer who used Google's pre-trained BERT model and fine-tuned it as a text classifier, resulting in a micro-average precision recall score of 83.9%, which is very good. The dashboard itself is a result of this combination of people-powered hand coding and cutting-edge natural language processing technology and machine learning techniques. Taken all together, it means that over 1 million responses now feel tangible as well as understandable and usable for advocacy purposes. It wasn't easy, and we are breaking new ground in many ways through this work. But we were able to push through when it felt impossible because it is important and essential, and because we promised the women and girls that their voices would be heard.
That's so true, Amanda. And now that we've officially piqued your interest and curiosity, let's get to the actual demo and show you how easy it is to use the dashboard for yourselves. So we're going to share our screen now, and together, Amanda and I will chat just a little bit about the features of the interactive dashboard and how you can navigate it to find the information you're looking for, and maybe even some information you didn't know you needed. We will also share some examples of how it can be and how it has been used by the global community to advocate for concrete, sustainable policy change to advance the health and rights of women and girls. So as we're pulling up the screen, thank you, Amanda. It really bears repeating that the What Women Want interactive dashboard allows for a truly unparalleled level of access into women's demands by connecting women's voices with the almost infinite possibilities of digital analysis. So when you're first accessing the dashboard, you will see this as your default view. There are buttons at the top of the dashboard that allow users to find out more about the What Women Want campaign, watch an overview video, and activate a step-by-step tutorial that will walk you through the dashboard directly and in your own time. So across the entire campaign, we were able to hear from women and girls from 114 countries, but most of the responses came from areas where White Ribbon Alliance works and where we were able to mobilize our extensive network of supporters and advocates. The dashboard only highlights responses from those countries that collected a significant number of demands, so about 10,000 or more. The first stop in the dashboard is to go to the section in the upper left that features the filter tools. Within this section, you'll see two tabs. One allows you to drill down to get more specific information on responses by country, category, age, and even keyword. So let's start with Kenya as a country for now. And then the other tab actually allows you to compare two types of responses. So this can be especially useful when you're attempting to contrast the responses from countries or to find similarities and differences between various age ranges. So let's choose Nigeria as a comparison here. Great. So then in the upper right of the dashboard, you'll see the number of women who responded either in total or for the specific filters you've selected and a histogram of their ages. So you're seeing that for 2 countries right now. And then directly below the filter section, if we scroll down, is the breakdown of women's responses by topic. As mentioned earlier, over 1 million responses were coded and categorized by White Ribbon Alliance, either through the extensive hand coding or through digital means, including natural language processing and machine learning techniques. So our codebook separated responses into 39 categories to cover demands ranging from more and better health professionals to water, sanitation and hygiene, family planning and contraceptive information services and supplies, and respectful and dignified care. Our codebook is actually available online to allow anyone the chance to see behind the scenes on how coding and categorizing decisions were made. It's just another way that we attempted to be as open as possible with this work. So immediately to the right of the category bar graph is a box that shows a sample of 1,000 responses. The responses reflect the categories you have filtered for, and the sample is changed every time the page is refreshed. The great thing about this dashboard is that you don't need to take White Ribbon Alliance's word for anything. You can see for yourself, and especially in this box, what women were saying. Because unlike other health questionnaires, which can turn women into unknowable graphs or printouts on a PDF or some static diagram, this actually allows you to see individual respondents' exact words. As we mentioned before, throughout this campaign, it just became abundantly clear from the women and girls responding that they wanted to have their voices heard, and they wanted this campaign to matter. This demand for openness and the desire to be listened to is at the heart of this dashboard, and you can really see that most clearly here in this section. Below the breakdown of the category bar graph, so scrolling further down, is a section that focuses on the top words and phrases mentioned within the response demands. So there are 3 views available: 1-word responses, 2-word phrases, and then 3-word phrases. So this allows for a much fuller understanding of what was actually being asked for and how often it was phrased and grouped and paired with other demands. So let's say we wanted to take a deeper look into women's demands in just Kenya for respectful and dignified care, which we know is also incredibly relevant in the provision of family planning and reproductive health services. We would just go back up and adjust our country preferences and select a category. So as we're looking at the top single word phrases for respectful and dignified care in Kenya, rising to the top, we see doctor in the 1-word phrases and respect and woman. So this might give you a general idea of what women were asking for, but let's click forward into the 3-word phrases tab. And this is very telling. If you look at the responses, you see abusive language, good communication skills, and use polite language popping up. Women and girls in Kenya are fed up with being treated poorly at health facilities. They want to be spoken to with kindness and with respect. Now you'll see on the map to the right that Kenya is highlighted right now. And we've seen how when selecting a country, the dashboard will filter and show only one response from that country. But you can actually also select multiple countries to look at. So if you wanted to look at responses from an entire region, we would just go back up to the filter box and we can just add here, Kenya's there, so we would add Uganda and Tanzania to the mix to see the dashboard at a regional level. So this selection process can also be done with age ranges, response topics, and keywords, and you can see that it adjusts the different boxes accordingly to reflect the regional results or by any filter. So let's now take a look at the family planning category. We'll start with the global results. So family planning was one of the top 20 asks globally. And when we scroll to the top 3-word responses after adjusting to select global by deselecting all of our countries and then selecting the family planning category, we'll just scroll back down to see our responses. And the top 3-word responses show that women want family planning methods and services, but also simply education and information. And they want this awareness and information above any particular or specific contraceptive method. So despite decades of information, education, and communication campaigns on family planning and contraception, women and girls are telling us they need more information. So if we wanted to know the nature of demands from Pakistani women, say age 20 to 35 related to family planning, we can narrow this down by going back up to the filters and set those parameters. Perfect. Thanks, Amanda. So now you'll see that the dashboard is filtered to only show responses that were tagged family planning and contraception in the country of Pakistan for women aged 20 to 35 years old. And when we scroll down to the 1-word, 2-word, 3-word responses, we can see in 1 word, we can see that birth spacing or simply spacing indicates in this context that they wanted access to family planning. And then we can even drill down further within birth spacing by going up to the search in the filter box to filter by the word space. So now we're only seeing the times that space was used within the family planning code in Pakistan. And that updates in every box for responses and for 1-word responses. So we can also exclude text. So let's try going back up, clearing out space, and instead let's exclude method. Awesome. All the changes happening in real time, dashboard magic. So now the dashboard is only showing us family planning in context outside of methods. So you can see what else women were requesting when it comes to having family planning and contraceptive services, information, and supplies. So this is just an example of how you can look through the dashboard for family planning information. And actually, our colleagues at White Ribbon Alliance Pakistan have already used the What Women Want demands to shape their provincial family planning advocacy by doing a deep dive into keywords and narrowing in on key themes from the results, just like how we've started to do. So for example, they were able to search against keywords from the 2-word phrases like doorstep and from the top 3-word terms like lady health worker to identify that accessibility of family planning and contraceptive services and information at their doorstep or in their village was important to women in Pakistan. So they did this by drilling down on several key words and ultimately reviewing women's demands, their very words, to understand whether they were truly asking for quality or affordability or information. And if I share my screen, you'll see that after their analysis, WRA Pakistan was able to present their top 4 priorities, which were accessibility, better quality services, presence of female healthcare providers, and increased knowledge and awareness about family planning to decision makers in Sindh province. And this is where power in numbers, power in words really comes into effect. Thousands of women's demands for family planning helps lead to a 5% budget increase for family planning in Sindh province. By supplementing more conventional data with women's top 4 demands, WRA Pakistan was able to leverage both an increase in the provincial family planning resourcing, as well as help guide how that investment would be spent to meet women's self-articulated needs.
That is such a powerful example, but also exemplifies how all of you at home, as advocates for women and girls, can use the dashboard to help make the case for the importance of investing in the full spectrum of women's needs in family planning, not just globally, but also nationally and at local levels. Family planning services are not effective if women do not know about them or if those services do not respond to women's realities. And listening to women in Pakistan made sure that decision makers were investing in the basic infrastructure to ensure that every woman has access to the family planning and contraceptive care they need.
Exactly. And we know that this is a strategy that works. And it's a strategy that you and I have been both a part of. The dashboard is truly a tool for everyone. It allows for collaborative analysis if you're, say, leading a team effort on a family planning policy or position paper, or it can help you elevate women's voices in your campaign messaging if you're a communications officer.
Absolutely. And who knows what else is possible and what other life changing policy decisions will be made because women's voices were actually listened to and acted on, and because their own words were actually seen. The dashboard really allows everyone everywhere the chance to examine what women want campaigns' responses at an unprecedented level of detail, a first for transparency in the nonprofit sector that we hope to see replicated in other organizations' campaigns, methodologies, and initiatives. Thank you for your time, and we are so happy to take any questions and to chat more about the dashboard and how you can integrate it into your own work. Thank you again.
Thank you so much.